We are now on the lifestyle section where we are going to look at your health. Today, we want to look at high blood pressure, which is something which is on the increase world over, but also in the country. And we'd like to find out why it is on the increase. And joining me today is none other than Dr. Gekonyo. Welcome, Anthony Gekonyo. It's good to have you. A cardiologist, right?
Yes.
Yes. Maybe we can just start off by, first of all, understanding if I went and I was diagnosed with high blood pressure, what does that mean?
Well, it means that your blood pressure is above the normal, and the normal range is between anything above 140 for the top number would be abnormal. And the problem with high blood pressure is a lot of people, I mean, the majority of people do not have symptoms. So the only way we'll find out is by checking your blood pressure, usually during a routine test.
Okay, and what's the routine test for one to establish high blood pressure?
It's a very simple thing, and we recommend everybody does it at least once a year, where we just put a blood pressure cuff on your arm and measure your blood pressure, at least 2 readings, maybe 5 minutes apart, and to establish, are you in the normal range, which is 120 to 140, or you're above that range, which is 140 and above. And then after that, we can sit down and have a discussion about if you are if you do have hypertension, what's the way forward.
Okay. I've noticed when you go into the triage, you know, just before you see your doctor, normally they do that. Is that normally what they're checking, the blood pressure, and is that a point of concern at that point if your blood pressure is high?
Absolutely. That's why we have the triage, because you are able to check one's blood pressure, heart rate, temperature, and even oxygen levels. And at least that would be the first reading to indicate whether it's something of concern or not. And then when you go into the doctor's office, more likely than not, if it's elevated, then they will check it again, just confirm if the first reading was correct.
All right. And at this point, I'd just like to let you know, if you're at home and you're watching, or wherever you're watching from, if you'd like to maybe ask a question or you've got some concerns, Dr. Gekonyo would be more than happy to answer your question. You can let us know, and you can then the numbers will be showing on your screen, which you can call us on, or you can also tweet on at Michael G. Gitonga, or you can send an SMS on 22155. Now, Daktari, what is the main cause of blood pressure?
The majority of people don't have, say, a specific cause. It's not like malaria, where we know you're bitten by a mosquito and then you get it. But we know that in a small group of patients or people, it'll be either because you have some problem in the kidneys, or maybe some problem in the heart, or some level of the hormone that's abnormal. But the majority of people, we're still not exactly sure why you get high blood pressure. We do know that as you age, your blood pressure will increase, and then some people will go over the normal range. And there's still a lot of work required to find out whether we're able to predict who will get high blood pressure or not at an early age.
And is high blood pressure a disease on its own, or is it caused by other factors?
It usually is a disease on its own, but it comes with other things. And we know that the other diseases that it usually comes along with are diabetes, high cholesterol. Those are the two that we also look for once we identify if somebody has high blood pressure.
Does lifestyle have a role in having high blood pressure?
A big role, a very big role, because we know that our lifestyles now are contributing significantly to having high blood pressure. And we know that if you're overweight, if you're not exercising well, if you're not eating well, if you're drinking too much, or if you smoke cigarettes, all that can contribute to high blood pressure.
Is stress a factor?
I think it is a factor, because you find that if you're stressed, there are reasons why that is. Either you're spending too much time working, not relaxing enough, you don't have enough time to exercise, and that can contribute significantly as well.
What are some of the highest stress factors, looking at the kind of age and day we're living in? It's a very fast-lane kind of a life. What are some of the things that we should look out for as potential stress factors and maybe try to avoid them?
Okay, I think mainly stress is related to work. I think we all have our jobs, our targets, and commitments that we have to achieve, and so maybe we concentrate on that more than, say, eating healthy, so that we don't take our good lunch breaks, we don't take time to prepare meals at night, we don't exercise, and we don't have time, or we don't find the time to relax. And I think it's usually related to work. And so what we recommend is a good work-life balance.
Okay. And what about diet?
Diet, I mean, it depends. I mean, if you're having chips every at lunchtime with a soda, then there's a problem there. Yeah. So,
But does the food affect your blood pressure directly, or is it that the food will affect your health in other ways and eventually cause blood pressure?
I think that's the correct way to look at it, because we know that if you're not eating healthy, you're most likely going to gain weight, and then that gaining weight will affect your blood pressure. But wouldn't say that the food itself, except of course for salt. We do know that salt has a direct effect on blood pressure. So if you're putting a lot of salt in your food, then that will definitely affect your blood pressure.
How does salt affect blood pressure?
Well, the thinking is that it causes retention of more fluid in the blood vessels, and that increases the blood pressure. And we do know that there are studies that have been done to show that populations who have low salt intake have a lower blood pressure than populations that have a high salt intake. And so there's a big drive to try and decrease how much salt people are adding in their food in a way to try and control blood pressure.
Okay. Does salt benefit our health in any way apart from just adding taste?
I mean, everything is good in moderation. Yeah. So the same way that if you have some fried food, it's good, or some meat, it's good. So if you have it in the right quantities, then it is healthy. If you have too much of it, then that's when the problem comes in. And it's the same even with something as simple as water. If you drink enough, that's good. If you drink too much, then that also can be a health hazard.
Okay. And what are the potential dangers now once you have been diagnosed with high blood pressure? What should I be looking out for?
Well, the concern always is that if you've had high blood pressure for a prolonged period of time, then it starts to affect the major organs, and those are the brain, the heart, and the kidneys. And even once you're diagnosed with high blood pressure, those are the three organs we monitor. So you may be at a higher chance of having a stroke or a heart attack, or going into kidney failure requiring dialysis.
Okay, what exactly causes a stroke? Because I know that's also something that's been on the increase. Somebody just collapses, they're taken to hospital, and by the time they get there, they're pronounced dead. What constitutes a stroke?
Well, we know that the brain requires blood, and so there are many blood vessels that supply the brain, and either one of two things will happen. Either there'll be a blockage because of a combination of high blood pressure, maybe elevated cholesterol, maybe diabetes, or one of those blood vessels will break and cause bleeding into the brain. And so whenever anybody has symptoms of high blood pressure, we ask them to monitor that closely so we can control it to decrease the chance of getting a stroke. But if you do collapse, then I guess the main thing is to come to hospital as quickly as possible, and then we perform a scan of the brain, usually called a CT scan, that will tell us what kind of stroke we're dealing with. But usually the symptoms for a stroke are either somebody has difficulty speaking, that's sudden onset, or difficulty using one side of their body, maybe their hand or their leg, or they suddenly can't walk. And that's usually the main presentation. But of course, in a severe presentation is where you just have somebody who suddenly collapses.
Okay. Now, I've seen in various websites and stuff that it's possible to actually tell a stroke that is coming. Maybe it is possible to identify for yourself or even for somebody who you're with. What are some of those telltale signs that one can tell it is not well?
Okay. Usually it's the person maybe you're having a conversation and they're not answering appropriately. Two, you can look at, as in maybe you say hello and then they say something completely different, or how are you today, or what day is it today? Or two, if you look at somebody, you'll maybe notice that there'll be some asymmetry in their face. So maybe one side of their mouth will be drooping, or they'll start drooling from that side. And then you'll notice that perhaps they're trying to move one side of their body and are unable to. But usually those are the signs, the speech, slurred speech, or the drooping of the face. And then usually once you see those signs, then you can, that's usually the precursor to a stroke.
Okay. And self, that is somebody who you're looking at and you can see they're drooping. What about yourself? How would you identify one that's coming up?
Unfortunately, the definition of stroke is just a sudden onset of a neurological deficit. And so there's no real way of knowing that there are no warning signs to a person, and that's why it's so devastating. 1 minute you're okay, the next minute you can't move your right hand or your right leg, or you can't talk, And so that's why it's such a devastating disease. And so there's no real warning for somebody. The only way we can mitigate that is to say, go see your doctor at least once a year, make sure your blood pressure is okay, blood sugar is okay, cholesterol levels are okay, and you're just doing the right things. But of course, even if you do the right things, it doesn't mean it will not happen to you. It just decreases the risk,
chances.
the chances of it happening.
Okay, we'll come maybe to self-management and how one can ensure that you keep your blood pressure at a good level, but still on the emergency part of it. If I identified somebody has got a stroke, maybe they've suddenly collapsed, I know it is vital that they get to a hospital as soon as possible to save their lives. But between the happening and the hospital, there might be a period of time there where it's just you and the person. What are some of the first aid things that I need to be aware of, and what can I do to ensure that at least they get to hospital as soon as possible, and then the hospital can take over?
Okay, so just like you said, the main thing is to get the emergency services involved. And the good thing is we have numerous emergency ambulances these days, and so they should be able to get to you within half an hour of calling, or even less. During that time, the main thing is just to keep the patient safe. So if you lie them in the recovery position, line them on the side, which is just lying on either, usually the right side, with one hand behind the head, one leg over the other one. And then just make sure that there's nothing, they're in a safe position. That's basically all you need to do. And then just keep reassuring them that this something has happened, the medical services on their way, and things will be okay.
Then get them to hospital. All right, now once you've been diagnosed with high blood pressure, whether as a result of something else or as a disease on its own, how do I now self-manage so that I don't get to that point where I develop a stroke?
Okay, the main I think we concentrate a lot on drugs, but more importantly is lifestyle. So you have to critically look at how you're living and make some adjustments, and that will include making sure that you find time to exercise, and you'd like to do that at least maybe, if possible, 30 minutes every day, but as much as you can. And that's usually aerobic exercise, so we're talking about either walking, running, swimming, cycling, going for those classes in the gym, but something that just makes your heart rate beat faster than normal, you break out into a sweat, and it keeps your body active. With that, we have what we call the body mass index, and we aim to get at a level between 18 and 25, and that's just something you can measure from height and weight, and it's something that's available at your doctor's office. After that, we need to look at diet and say, am I drinking alcohol? How much am I drinking? Am I eating red meat? How much fried food? How much salt am I adding? And then speak to a nutritionist or even with your doctor and make adjustments to that. And then of course, lifestyle and stress. So we'd say, am I spending Monday to Sunday in the office, not finding time for, I guess, to relax or to go on holiday? And that also needs to be adjusted, But all these things are just there to decrease your chance of getting a stroke. It doesn't mean that if you follow these things, you won't get one, but the chances will be...
It's not a guarantee that you'll not get one.
It's not a guarantee,
Okay. Now, does family history have any role to play? In other words, if I look down my family history and maybe there was a case of high blood pressure, we've seen with cases like diabetes, family history is important. Even if it has not been identified in me as an individual, the fact that my family may have had that history, is high blood pressure one of those diseases where we need to check our history?
No, it is, and that's why whenever you go to your doctor, there'll be certain questions that they'll ask, and one of them is, is there any high blood pressure, say, with your brothers or sisters or your parents? And if there is, then there is a stronger likelihood of you getting high blood pressure. So if you know that your brother has it, then it's something that everybody should be checked once a year, because it's such a simple thing. You put place a cuff on your arm, and in a minute you know whether you have high blood pressure or not. But yes, family history is significant, and we know that if you have somebody in the family who has high blood pressure, you're more likely to get it.
All right. Okay, we have Sarah from Kibera. Good morning, Sarah.
Good morning to you.
Yes, good morning, Sarah. Go ahead with your contribution or your question.
Mimi kwa mzima daktari nauliza kuna uhusiano ya epilepsy?
Sorry, rudia kuna?
Naulizaje? Hello?
Yes, nakusikia.
Nauliza kama kuna uhusiano wa epilepsy na high blood pressure.
Okay.
Why I'm asking you that? There are sometimes back niliangukaga, then wakati nina usi daktari akasema niko na epilepsy. So mimi nimekuwa nikishangaa kwa the medicine that nilipewa hizo mbili. Kuna dawa nilipewa mbili, epinephrine and casamezatine. Nilikuwa nikizikunywa twice per day. Nilikuwa nikikunywa hizo dawa, daktari nasikia ni kama mwenda wazimu, yani nasikia ni kama kichwa kinang'oka. Sasa nashangaa, is it true I'm epileptic ama kwanza niliambiwa hata niende nifanyiwe scan ya kichwa? Yani nimekuwa tu nikikunywa tu dawa lakini nazikunywa nikishuku.
All right, asante Sarah. Okay, we also have Njoki. Njoki, good morning. Your contribution, please.
Good morning to you.
Yes, go ahead.
I wanted to get an insight on why would a person have a low blood pressure of 95/55?
5/50.
And what are the implications of having low blood pressure on a person's health?
All right, thank you, Njoki.
Yes.
All right, thank you very much. Okay, Daktari, we start with Sarah, and she's asking if there is a relationship between uhusiano with high blood pressure and epilepsy. Then she also mentioned some medicine that she was given, and she has a splitting headache.
Okay, so I think there are two different diseases, epilepsy and hypertension. However, if you do have hypertension, develop a stroke, that can cause what easier term to use is a scar on the brain. And as long as you have that scar on the brain, then you have a chance of getting a seizure. And so that can happen if that you have high blood pressure, develop a stroke, and then proceed. But to say patients who have, or people who have high blood pressure don't necessarily have epilepsy, and if you have epilepsy, doesn't necessarily mean you have high blood pressure. Of course, whenever you're given medication by your doctor, if there are any problems that you face at home, then the best thing is to go back to them, explain the problems. They'll go through maybe there's a particular medicine that we know that may cause headache, and so they'll say, well, let's remove this one because it's clearly causing a problem with you, and then we'll give you something else. So that's a discussion she needs to go and have with her doctor again, to say you need the medication, but there are many different types of medicines that one can use. Yeah.
Okay, for the same thing. Okay, we also have Njoki, who is concerned about low blood pressure. One, what is the cause of low blood pressure? And she's given us 95/55, and what are the implications?
I think the first thing to note, Njoki, is that there are people who just have low blood pressure, and that's a small number, but that's who they are. They may go get checked and they'll notice that their blood pressure is okay. We're worried about low blood pressure when you start having symptoms, and those symptoms are either difficulty breathing or dizziness or collapsing. And then if there are any of those symptoms, then the question now is why is it happening? And so we'd look at your heart, we'd run some tests on hormones, we'd check your kidneys, we'd do a thorough evaluation to try and determine why is the blood pressure low, why you getting these symptoms, and then after that we can determine how we can treat. Yeah.
Okay, is low blood pressure a cause for concern in regards to cardiac arrest?
I think it's whenever something is not within the normal range, then the first thing to do is do the basic test to determine is it affecting any of the organs, and then also monitoring it, because you may find that somebody has had low blood pressure since maybe they were 13, and every time they go to see the doctor, that's what they see, but it's not causing any symptoms, and they're able to live a normal life. But it's not because of low blood pressure, unless you have some underlying disease, say like maybe the heart is weak and not pumping well, then you have a higher chance of having a cardiac arrest. But if you have low blood pressure and we've done all the tests to confirm that your organs are okay, then there's no more risk than anybody else who has normal blood pressure.
Okay, you had mentioned earlier that high blood pressure can cause stress on the heart. Does low blood pressure also cause stress on certain organs?
I don't think we've, not that I'm aware of. I think we concentrate more on high blood pressure because we know of the risk related to it. Low blood pressure is usually either a symptom of one of the organs not functioning well. So for example, if you've had high blood pressure for a long time, it may affect the heart itself. the heart becomes bigger, it doesn't pump as well, and then you go from a position where you have high blood pressure to low blood pressure just because the heart is not able to pump normally.
Okay. Then you also mentioned a 13-year-old, and I know traditionally we've always associated high blood pressure with elderly. Does high blood pressure and low blood pressure have an age limit where you're concerned more than others? Does it affect every age group?
No, we're usually, I guess in the past we've been expecting to see it in people who are above 40 or above 50. That's when we start seeing issues with high blood pressure. That doesn't mean that it cannot happen earlier, and there are certain diseases that can predispose even young children from having high blood pressure. So if you say, for example, have a narrowing of the blood vessels to your kidney, that can cause high blood pressure even in somebody as young as 13. But we need to screen more because, of course, with our lifestyles, we're finding children are obese. That's already a risk factor for high blood pressure and diabetes. And so we need to, and in those cases where we don't find anything specifically wrong with the body, then lifestyle modification would be the best thing for that child. And we'd find that if they lose weight or eat better or start exercising more, then that's something that can be controlled.
Okay. Now, for somebody who maybe has high blood pressure and low blood pressure and they wanted to donate blood, is that something you can venture into? Is that something you should be concerned about?
No, the good thing about blood donation is that they have a list of, there's a questionnaire that, or at least there are questions that they'll ask you or they should ask you before you donate. So having high blood pressure is not a contraindication to donating blood. Having low blood pressure, I'd say go see your doctor first, determine why is it that you have a low blood pressure, and then after that, because of course if we're taking blood out of your body, it will affect your blood pressure by possibly bringing it down a little bit. And so if you have low blood pressure, it'd be important to know why is your blood pressure low before you donate blood. Yeah.
Okay.
Yeah.
All right. Now we have Marilyn in Nairobi. Marilyn, good morning. Your contribution or your question? Hello, Marilyn. Yes, your question or your contribution?
Nilikuwa nataka kuuliza kutoka 2012 huwa naumwa na kifua. Nikaenda hosi, then nikaambiwa CBP. Inaweza kuwa ni nini?
Kuumwa tu na kifua?
Kuumwa tu na kifua.
Okay, asante Marilyn. Jockey, or is it Cynthia? Sylvia. Good morning, yes. Sylvia.
Yes.
Yes, please go ahead with your contribution or your question to Daktari.
Okay, question yangu ilikuwa okay, I'm 2 months pregnant. Good morning.
Yes, 2 months pregnant.
Nilitaka kuuliza daktari, niko 2 months pregnant. And I'm having like low blood pressure.
You're having?
Low blood pressure.
Okay.
So I don't know if it's the effect and how can I manage this?
Okay. All right. Thank you very much, Sylvia. All right. We have Marilyn, who is complaining of chest pains. She's been to hospital, and she's, according to the hospital she went to, they said it's not TB. What else could it be? And I guess this we could also look as a cardiologist. Could it be something to do with the heart? That's
a good question, and that's, I guess, one of the things we need to find out. We know that chest pain can be because of the heart, and we know that it's a sign of a heart attack as well. And so anybody who's having chest pain should be evaluated, and it shouldn't be something that you should ignore, especially if you have chest pain that's left-sided, that may be moving from the chest to the hand, associated with sweating, difficulty breathing, or feeling like you want to vomit, and it comes on in particular when you exercise or exert yourself, and then goes away when you stop walking or stop doing what you're doing. And so what we'd recommend is for her to, at the very least, have what we call an ECG, and that is a facility available in most hospitals, and then from there they can decide what else needs to be done. Of course, there are many other reasons for chest pain, and if she's coughing, maybe that's why they were thinking about TB. It could be muscular. It could be sometimes we have stomach upset or heartburn that feels like chest pain. So there are many things that it could be that she needs to go sit down with her doctor again, at length, go through the symptoms, what brings it on, what takes it away, and then narrow it down so that we're not just doing many tests. We can focus on at least which tests are required immediately. But an ECG would definitely be something worthwhile.
Okay. And is an ECG something affordable? Sometimes, it's down to cost and...
Yeah, I mean, on the higher side, I imagine it'll be 1,500 shillings.
Okay.
Yeah, and I'm sure you can get it for less than that.
For less than that. All right, we also have Sylvia, who's 2 months pregnant, and she's also concerned with, she mentioned, was it low blood pressure?
Low blood pressure. I mean, low blood pressure and high blood pressure are two different things, and I think in pregnancy, we're more worried about the pressure going higher than being low. But again, she should sit down with her gynecologist, obstetrician, then, because the good thing about when you're pregnant, we expect you to be seeing your doctor often. And during that time, they should be measuring your blood pressure, heart rate, checking your blood counts and everything else. And so, like, the issue with the low blood pressure is, are there symptoms or not? And so is she having dizziness? Is she feeling excessively tired? And those are things to discuss with her obstetrician. And then if the obstetrician is concerned, then they would then send them to the cardiologist. Some tests for the heart can be done, and then to determine whether this is of concern. But it is known that blood pressure can vary during pregnancy.
Okay.
Yeah.
And is high blood pressure a risk to the baby? Yeah.
Very much a risk to the baby, and so anybody who's noted to have high blood pressure during pregnancy needs to be monitored more frequently, may require medication to control the blood pressure, and sometimes it gets to a point where they may even require what we call an emergency cesarean section to ensure that the pressure doesn't affect the baby's health later in pregnancy.
All right. And well, before we are joined by Sophia, my colleague, and she gives us our comments and some of the SMSs that have been coming through. Maybe just quickly, if somebody wanted to get in touch with you, how would they do that, where they can find you?
Okay, thank you for that. I'm working at the Karen Hospital, which is on Langat Road in Karen. We're available Monday to Saturday. 8 a.m. to 6 p.m. and I can leave your number with me. Yeah.
Okay.
But our details on the internet, so we're easily. Yeah, it's not difficult to find myself or my colleagues. It's just the Karen Hospital. If you type that on any search engine, it will come up.
It'll come up. All right. Thank you very much, Dr. Anthony Gekonyo. That was very enlightening. And now we'll be joined by Sophia. Sophia, do you have some comments that are coming through?
Yeah, quite a number. Maybe if you have time, I can ask this question for Carol. She's sent a message. She's asking Daktari, can high blood pressure cause stillbirth?
High blood pressure can cause a lot of issues with pregnancy, and of course it can affect the health of the baby. And so the whole idea is that close monitoring with your obstetrician, regular ultrasounds to check the health of the baby is key to making sure that we don't get to a point where we have a stillbirth. Yeah.
Okay. Director, do I still have more time to ask another question? Yes, okay. There's another one here. Let me open it. Okay. I am hypertensive and on medication. My blood pressure is now okay, but I've recently been experiencing dizziness and lack of balance together with swelling of feet. What could be the problem?
We need to go back and now reassess the diagnosis. Whenever you have high blood pressure, there are a few tests we recommend, and one of them is called an echocardiograph, where we actually look at the structure of the heart and see how it's pumping. We're also worried about the kidneys, so I'd say they need to go back to see their doctor, have a kidney test, get a closer look at the heart, review the medication, because dizziness is usually a sign of low blood pressure, and the swelling of the legs is concerning, and maybe it's either related to the medication or something else going on in the body. Yeah.
So I figure then with most of these questions coming through, at the bottom line, at the end of it all, it requires for some tests to take place.
Absolutely.
To definitely ascertain some of the issues going on there. Thank you for joining us on Your Health, and everybody for watching this morning. We appreciate all of your feedback, your thoughts, and even earlier on when we had Senator Bungoma County, also Minority Leader in the Senate, Moses Wetangula. Quite a number of your thoughts that came through. Atieno Okeo, you said it was a very concise conversation. You're his great supporter. You called him my code principal, very eloquent as well. And many other of your thoughts. Some of the questions you had, I did manage to ask them. So that's excellent. And we'll be posting the interview later on our website, so we'll be able to watch it there. And Michael is joining me now on the anchor desk. So great Tuesday this was.
Yes, great Tuesday. And one of the things I'd want to ask you, Sophia, is have you had your blood pressure checked recently?
No.
You haven't. Do you know your BMI?
Yes.
You do?
At my gym, well, you have to get that checked so that they know what
where
they're
to start
working
off.
with. Yes.
Okay.
So
That's a good gym.
I'm super healthy. In fact, they have this thing, I don't know if Daktari, although we don't have him now on short, where it even shows you, like, in terms of your age, like your system, is it operating like a
the age that you should be.
50-year-old or as a, yeah? So I'm told Daktari Kanjibu, is it true that there's a way you can work out and live out your life such that your system operates like a teenager or like this old lady and yet you're a teenager?
We'd always like everybody as they grow older to operate in a younger level.
younger age.
Absolutely, yeah.
So it's possible.
It is possible.
Yeah.
Yes. Yeah.
So I'm one
Great
of
stuff.
those,
Guys,
honey.
that's good
I'm
to know.
operating on a younger
On
level.
a younger level. No wonder you have so much energy every single day, which is a good thing.
We
And
thank God.
great. Well, if you've had your BMI checked, I was going to say, if you haven't, you better do that.
Have
'Cause I
you
got,
had yours
yes,
checked?
I've had mine checked.
Are you healthy? Okay, don't tell us.
This is where we wrap it up and call it a day and wish you all a fantastic, wonderful day.
Okay, clearly kuna watu wanajishuku hapa.
Sio kujishuku ni kujijua.
Okay, so yeah, have your BMI checked, and but like what Dr. said, bottom line, I know with this, a lot of this blood pressure stuff, you have to be very careful what you're eating and also just your workout.
Right.
This is a temple. I always say, you know, your body's a temple, so you must take care of it as such.
Yes, and what I realize is that most of our diseases nowadays are actually lifestyle.
It is.
It's purely
We are
lifestyle.
pizzing
So
away.
if we would change how we live
Yeah.
as much as we can, we'd be a very healthy nation.
That's what I was telling you, it's good to have a cheat day, because nobody says, like, don't eat all of this really yummy stuff that sound like illegal substances. Okay, like now pizza and the fries and all. But
And just FYI, yesterday was her cheat day.
yes,
She was cheating on
once
her
in a
diet.
while you have one cheat day, and yeah, and then other days you stick to the narrow, straight and narrow.
Right.
Yes.
Well, this is where we call it a day and wish you all a fantastic day. Thank you so much for joining us. My name is Michael G. Gitonga.
I'm Sophia Wanuna.
You forgot your name.
Gitonga.
Yes.
Yes, because I said Gitonga, then I felt like maybe I should
Confused
say
you.
something else. So I'm Sophia Wanuna N. My dad's name is N.
Well, what? I didn't know that.
Yeah.
Learn something new
It's
every day.
another day. Let's see you tomorrow. Have a lovely day. Bye.